As February is traditionally the month of love, I thought this month I would talk to you about love languages. Traditionally, we think of love languages and how they relate to our relationships, but actually, let's think about how they relate to our relationship with our patients. So let's go through them one by one. Words of affirmation. When you're in a romantic relationship, then typically you show words of affirmation by telling your partner that you love them, telling them that you find them attractive, telling them you appreciate them. With our patients, as cosmetic dentists, you give them affirmation all through the process that they're a great patient, you love seeing them, and that they look great. Number 2 is quality time. So obviously with our romantic relationships, that's spending time with your partner and making sure that you're giving one-on-one time to them. With our patients, that is still giving them our time. So never letting them feel rushed. We want to make sure that when they come in, you're stopping, you're looking them in the eye, you're giving them your time, you're really listening to them. Number 3, receiving gifts. So obviously in a relationship that's self-explanatory, Valentine's Day, birthdays, or maybe just randomly this person likes to be giving gifts, and similarly that same person, when they come to your dental clinic, if at the end of the appointment you give them a free floss, or at our clinic it would be branded skincare, then these are all things that they'll really appreciate because they have real value for receiving gifts. Number 4 is physical touch. In a relationship, obviously that's holding hands, that's hugging, and maybe this is one that could be a bit controversial within the dentist-patient sense, but I don't think so. The occasional reassurance by popping your hand on a patient's shoulder to be like, are you feeling okay? Or offering your nurse to hold your patient's hand while they're having an anesthetic, or if they're feeling a certain way about a procedure. Obviously physical touch with a patient, you always want to make sure you have their consent, and equally within a relationship. And last but not least is acts of service. So within a romantic relationship, acts of service are doing lovely things for your partner, like cooking them dinner, cleaning out when they didn't expect it, small things that you might do. And equally it's the same with your patients, small little gestures that you can do. When it's their birthday, you can have happy birthday playing in the patient lounge for them. It's remembering the coffee that they like to drink because there's a note on their file, and coming in saying, oh, I know you like the dark roast, let me make that for you. So these are all the little ways that someone for whom acts of service are really important will probably really love coming to see you and appreciate those small things that you do. I hope that helps, and I hope wishing you all a lovely February filled with love, whether it's with another person in a romantic relationship, or if it's self-love and just appreciating yourself. Let's all appreciate love. It's a great opportunity to do that.